It's about 3 months since I noticed hard lump in my breast. 2 months since I tried to find a doctor to see it, do something about it. A month since I was actually diagnosed, and a week of first chemotherapy. I'm 30 years old. I have 7.5-month-old daughter who I exclusively breastfed till a week ago. My cancer is one of the most common ones. It's called IDC, or invasive ductal carcinoma. I have 3 lumps in my left breast. The biggest one, I think, was 2 centimeters or something. The other 2 were smaller. I also have 3 lumps, 2 to 3 lumps under the arm that PET CT scan showed is cancer. And the biggest lump under the arm was about 1 centimeter. PET CT scan also showed it hadn't moved forward from the lymph nodes, which was great news, very great news. Biopsy of the breast lumps showed that it is estrogen and progesterone positive. Again, good news. And HER negative, which is also good. It's a typical cancer if you get it in the breast in my age. Growth rate was very high. It's called high if it's over 20%. I was 72%, so it's aggressive, which I don't like. But because I'm young, it's at young age, the younger you are, usually the more aggressive the cancer is. They also did gene test, the most common ones, the BRCA1 and 2. I was negative. They're going to do more testing, which take more time, to see if there are other mutation genes that are related to breast cancer, and we'll see. And I got started with chemo before surgery, so we do the chemo first. Main reason was to wait the test results from the gene mutations, because even if certain cases, even if you can save the breast and you have the gene mutation, there is no point saving it, because the mutation will cause the cancer to come back. So that's why we decided we just first wait with the surgery. We just do the chemo first, see, maybe it will even shrink. It's also possible. I'm really hoping that. And then we'll see what the gene test says, how big the cancer is, this and that. And then if you take the breast off, take both off, or do the breast conserving surgery. Yes. It was extremely hard to get somebody to actually do a mammogram on me. It was hard. As I said, 2 months ago, I tried first time to go to a doctor to look at it. I thought, I just go to a doctor and, within maybe a week maximum, they will do a test and I will know what it is. It didn't turn out like that. It took a month. Because it took me a week to get the regular doctor. And I had to lie. It would have taken longer. But I had to lie, like, I have an emergency, that can you see me? And so, because you can't just go to an oncologist, you need a referral. So I went to this regular doctor. She just looked at my breast. She didn't even touch under the lymph node. If she would have, she would have felt that there was a lump. I didn't know that. I hadn't touched it either, but it was there. So she just touched my left breast. Yes, there is a lump, and sent me a referral to a oncologist, which was at that point 3 weeks. 3 weeks. Can you believe it? So because of my insurance, I can be seen only in one hospital. That's the situation. To be totally fully covered, I can see only in one place. So I had to wait 3 weeks. So instead, what I did, I waited a week, and I was like, okay, this is ridiculous, and I went to a different doctor. That's what I did. I paid. I wasn't covered fully. I was somewhat covered, but I paid, and this doctor saw the lymph node that's swollen, and saw the lump, and scheduled me. Actually, the doctor who was out of this hospital scheduled me mammogram and ultrasound in the hospital that I was covered. She was that good. It was that good. Because I explained what the situation is. I said, this is stupid. Nobody's seeing me. And she got it. And I think she might have saved my life. So just because I went outside the network coverage, found somebody to really care about me and take care of this situation. So it cost me a little bit, not much, very little, considering how much the insurance ends up covering. So yes, since then I got there, like they didn't even have an appointment for me. This other doctor just called this hospital, explained them, and made them take me in the day. Like she just made them take me between appointments. Just so I was told, okay, go to the doctor, we will find you appointment mammogram time, just come here. So I went there with my baby, by the way, my 6-month-old baby at the time. I waited. It took them about 2 hours to find me an appointment for mammogram. So they did mammogram, they did ultrasound. They say, yes, you have probably cancer. Radiologist was very, very nice. Actually, radiologist started crying when she told me, because she was a very young mother too. She had, I think, a 10-month-old. So she was very, very affected by this. Because I went there and the whole staff was taking care of my baby while I was having those mammograms and ultrasounds. So everybody were like holding her, and even the radiologist. And then on the spot, the radiologist was so nice. She made me see surgical oncologist the same day. So I waited several hours. My baby father came there, and he helped me so much. And so we waited. I saw the surgical oncologist the same day, because I needed a biopsy and I needed approval. So a referral again from an actual surgical oncologist to do a biopsy. And so I saw this doctor. I got the biopsy, like I think 5:30. So they were so nice. They waited after the workday ended at 5 o'clock, and they did the biopsy and left the markers in 3 of those lumps. 5:30, and then I waited. I mean, they already knew, that it's cancer, but you have to actually be treated. You have to have it documented without doubt. So that's what the biopsy was for, plus the markers, and they didn't touch anything under the lymph node because it just makes trouble. Then I waited about a week. The biopsy was Thursday. I got Tuesday. The radiologist called me, yes, it is cancer. And then the surgical oncologist called me, said, well, we have ordered you a PET CT scan to see if it has spread even further, or how far it has spread. That was very difficult because I had to wait another week from that point. I mean, I knew I have aggressive cancer, and they, basically tell me, okay, you just have to sit and wait until we find you an appointment for PET CT, which to me was horrible. But okay, so I waited that. In the meantime, I also got a gene test scheduled. I got that one. Then I got PET CT scan. I saw a medical oncologist who decided that, okay, that was, so I got, actually I saw the PET CT scan the same day as a medical oncologist, and she decided that I'll go, even before the PET scan results came back, she put me on chemo. She decided, okay, we just do the chemo, we wait with everything, this and that comes back before we do the surgery. But the thing is, then, so doctor orders you chemo, and then you cannot schedule chemo earlier than a week. So I had to wait another week to actually start the treatment. So why I'm telling you this is so that you would know how painfully slow, horrible it is. You just have to wait, and it's just growing inside you, and everything is affected. And so PET CT scan, we got results back in 24 hours. It was great news. It hadn't gone further from lymph nodes. Great. It just showed the same stuff that was in the left breast, and they were not able to tell if it's either 2 or 3 lymph nodes under the arm. They didn't see anything around, like sentinel ones. I don't know how small they can actually see, because PET CT is supposed to be currently the best technology, though the smallest ones technology can show you the cancer cells or clusters, but they cannot sell you the individual ones. Okay. Cancer. Hope the treatment works. I hope the treatment works.